Someone asked me the other day when I was giving a guest lecture in Boston, how do you reconcile the fact that we have privilege? Survivor's guilt is a huge, huge piece of what is happening, and in any war. And all four of my grandparents were refugees, and my grandmother is the only one left. I talked to her about this over tea once many years ago, and she said, don't waste time. Don't waste time feeling guilty about privilege, because tomorrow you may not have it. Tomorrow anything could happen to you, just like war happened to us. Refugees is not a person, it's something that happens to you as a result of needing to flee. And so while you still have that privilege, use it as much as possible as you can for someone else. And so be bold in being able to advocate for others, provide, to extend solidarity, and make it less about us and navel gazing and more about what we can do in the time that we're given.
Hello and welcome to the Third Culture Therapy podcast with me, Layla Maghrabi, where we explore the intricate, sometimes difficult, and always fascinating relationship between heritage and mental well-being. Just now, you heard the voice of Dr Alexandra Chen, a child psychologist and trauma specialist who has spent over a decade working with war-affected children and families in the Middle East and Africa. Dr. Chen's work spans some of the most challenging humanitarian crises, and she helps design mental health interventions for refugees dealing with the fallout of conflict and displacement. Dr. Chen has worked with organizations like the United Nations and the World Bank, focusing on how trauma, particularly when experienced by children, can impact brain development and stunt education. We'll be diving deep into the effects of conflict on the brain and behavior, and discuss how and why mental health issues so often manifest in schools. I'll ask how she copes with the emotional toll of her work and what wider lessons she's learned from helping children in such extreme conditions. This episode is sponsored by Paradise Fold, the silk hair wrap brand that has done wonders for my locks. If you've seen me on Instagram or YouTube, you'll know that I have thick, curly hair that I love to show off. But it used to take a lot of time and product to tame, particularly after a night's sleep. But I've been using Paradise Fold for a few years now, and aside from being beautifully designed, what makes them so special is that they're made from 100% silk, are double layered, and reversible. That's maximizing both wear and style. Since using them, my hair looks healthier, more hydrated, and less frizzy, without the need for chemical-based products, and all while I sleep soundly. They boosted my confidence and given me back a whole lot of much-needed time to do my work. In fact, they're so elegant that I sometimes wear them around the house during the day. So if, like me, you're a time-poor woman with just the right amount of vanity and are after a one-stop solution to world-ready hair, head to Paradise Fold this week with the code TCT12 for a special discount for our listeners only. And now, without further ado, welcome to Third Culture Therapy. Thank you very much for joining me here on the Third Culture Therapy sofa. It's really a pleasure to have you.
Thank you. That was super exciting.
Before we delve into the incredibly important work that you do with children and trauma, I want to get a little bit personal and ask you about your identity, because you have many elements to that. You were raised in Hong Kong. You have lived and worked in the Middle East for over a decade. Something I didn't mention in the introduction is that you speak 10 languages, including Arabic, beautifully. I've heard you speak it. And you are married to an Arab man, and you live in the UK. So which of these many and multiple identities do you most closely relate to?
I think that's a great question. And I will be cheeky and say that I don't think any one of them are definitely, I think, third culture kid, probably. I've gone way beyond third at some point. But I hold all of them dear, and I think I've had very much the privilege to, in some ways, pick and choose the pieces that form my identity, and over time that's also evolved. Very much identify as a Hong Konger, but as many of my friends will say, my heart is Arab. A lot of them will fight about whether I'm Palestinian or Lebanese or Syrian or what have you, but I also grew up with being part of colonial Britain at the time. Very much identify with a lot of those cultural elements as well, and then different pieces of I've worked in 15 different conflict or post-conflict zones, and so different pieces of that I have carried in my heart, and I think I always will.
Yeah. Speaking of conflict, we are, of course, living through one of the most devastating ones in recent history, a year into a genocide in Gaza, a year after the Hamas attacks in Israel, and most recently, there's been the expansion of this conflict to Lebanon, a place that you've obviously lived and worked in, and where you have family at the moment. And most recently, you just launched a program specifically catered to trying to help people affected by what's happening. And that's the Healing for Gaza organization, which provides mental health support for people who are in or have left Gaza recently. Is that right? Yeah. Please tell us more about what you are doing with this organization, and also how you are managing to keep this going while the I suppose the continuous challenges that we're facing across the region.
Yeah, sure. So it's an initiative. We are fiscally sponsored by a registered charity, but our work is in some ways very straightforward. We are providing trauma therapy for children, parents, and frontliners who are affected by what's happening in Gaza. And so some of our patients are inside Gaza, and then some of them are have been evacuated, mostly to Cairo, but a lot of them have, some of them are in other places. Our work is really to offer what pieces of healing we can for those who need it and who are ready. A lot of people who need it, who are not ready, and we respect that entirely. I'm very grateful to be working with, we have a team currently of 15 clinicians, the psychotherapists, psychologists, psychiatrists, who are offering their time and their expertise, particularly in trauma. Not everyone is war trauma specialised, but that's where we come in to provide very intensive training for everyone who onboards. Some are native Arabic speakers, 9 out of the 15 are, and then 6 aren't. And then we have a team of amazing medical interpreters who are mostly in their 20s, but just have extraordinary, compassion, but also professionalism at the same time. And they also go through intensive training with us to be able to do this work safely for both the patients and for themselves, in terms of secondary trauma, and then also to do so ethically. So I have the huge privilege of working with an amazing team. I mean, in addition to our clinicians and interpreters, I have my program manager, who himself, he's from Syria. He was a refugee for 8 years in Turkey. He is a master's psychology student, and just one of the most empathetic but also efficient people. The combination is just extraordinary to me. And then also our clinic coordinator, who's a Palestinian from Lebanon. She's a firecracker. Do not piss her off. But she's an octopus. She's connecting all the patients, all the clinicians together. And then our comms person, who is Lebanese, who's right now volunteering in a shelter in Mount Lebanon, who has also extraordinary compassion, but is working so hard to be able to tell our patients' stories as well in the most authentic way, because not everyone has access to the sort of the layers and the nuances of what such violence and what such genocide, but also a genocide that goes unchecked, does to a human psyche.
What does it do to the human psyche? What have you seen it do?
Many things, and different things over time, even at 3 months in, 6 months in, and then over a year now. I think obviously in the beginning, I think there was the expectation that this was just another war at some level. Not that it ever is okay, but that they could handle it, and that the 50-day war before that was as extreme as it could get. When that point was passing, I think then there started to be the panic to say that we've never seen this before. And then as it has gone on, the realization that it could go on forever, and that there's no real effort to stop it, and to stop the extermination. It's terrifying. The second, though, is that war inevitably fragments a community through the displacement, but also through the separation of families, whether someone's in a camp in Mawasi and then someone else is, is still, at the grandparents' house, for example, trying to take care of an elderly person, or whether they've been evacuated to Cairo and then the crossing closed before they thought it was going, they knew that it would, and then they've been separated from family. So there's a physical fragmentation, but there's also the lack of connection that happens. Yeah. So, for a lot of the evacuees in Cairo, who are now coming up at 6 months because the crossing closed, which I heard about in April, that they have not been able to share what they are suffering in displacement with their families inside Gaza. Because as they say, why would I? I am physically safe now. I would feel so guilty to tell them that, oh, I'm depressed, that I'm isolated, that I'm alone, that I have no way of either going back to school or getting a job. I feel unwelcome here. And so then one of my patients said to me, she said, my mother and I, we were best friends and she knew everything about me. But now I feel like a stranger because she knows nothing about me. She doesn't know what I cry about. She doesn't know what keeps me up at night. She doesn't know about the nightmares I have. As far as she's concerned, I will only tell her I'm fine. She may have an inkling, but the details are shared by no one. I think the biggest piece, though, is the despair of feeling forgotten by the world and of being abandoned big time, particularly by communities that are Arab and Muslim as well.
Yeah.
Not just the politics that go with that, but just at the human level. Fewer people are donating. There's obviously that donor fatigue. More people are raising prices on them wherever they are displaced, and so the feeling that you want to take advantage of their vulnerability.
It's a betrayal of humanity, really, isn't it?
It is. And like I said at the Oxford Trauma Conference a couple of weeks ago, one of the foundations for healing that we often need to establish as psychologists is that of safety. Whether that's physical safety or emotional safety. But do not underestimate what it means for a child whose understanding of the world is that it's fundamentally unsafe. Not just physically it's unsafe inside an open air prison, but that the world as a community has watched this happen and has not stopped it, and seems to be okay with the level of brutality that they've experienced, and therefore the world is fundamentally unsafe. So at some level, the only logical response is then to always be in hypervigilance, to always be in survival mode. You can't relax. And a lot of people may term that resilience, and I can talk about that, but that comes at a cost.
Yeah,
so
a very high cost.
Yeah.
Not just obviously to those people who are suffering, but to inevitably to everyone who will come into contact with them, and then subsequently, the world at large, really, if we're going to be creating so many traumatized people. With this work, with Healing for Gaza, given the magnitude of the suffering and the psychological toll that it's taken, what are you able to offer, and how can therapy, like the kind that you are offering, help?
One is the space, the non-judgmental space. So many of our patients, we ask during the triage, what do you want? We give them agency, and again, I can talk about sort of the specifics, but a lot of them say, well, be a non-judgmental person. That's really important to them. To be angry, to be absolutely raging, to be grieving, in the biggest of ways, but also to be silent and to be catatonic, and to sit with that which they may have to even put aside in order to be in survival mode most times. And I've learned really over time not to underestimate that. In addition, though, there have been the practicalities of being able to cope. So how do you sleep? Without sleep, you cannot function. And without sleep, you get more angry, you get more stressed. And without being able to eat, that adds to just the overall feeling of falling apart. And so practical tips on how to do so is something that we can offer. through the different therapeutic modalities, depending where someone is, both in their suffering, but also in their needing to function. EMDR, for instance, has been very powerful, especially for those who've seen us for a few sessions and are ready to do so. Learning to regulate breathing, be back in touch with your body for those of us particularly who might dissociate in these moments, but to do so safely does restore, I think, a sense of being connected to the world and hopefulness. But I think most of all, it's just a reminder that they matter enough for us to do this.
They matter enough to you. Also, what I'm hearing from what you're saying is that, and I take a lot of sort of joy from that, is that they matter to themselves enough to also say, actually,
invest in me.
I am going to try something, and I am going to put my probably just last bit of remaining faith, I imagine, but in someone else, and that can hopefully go some way to restoring the damage that's been done within the fabric of like society at large and humanity, and that's part of surviving and hopefully coming back stronger. And this is also something I always say to others, friends, family, but also to myself as a reminder that doing that healing work for yourself is not only, it's not selfish, which in case anyone thought that was, but it's actually, it is an act of kindness and generosity to others, because when I do that, and I'm speaking from actually just very, very recent experience where I did some things that I really sort of took care of myself and filled my cup, and I came out of it and found all around me so many people who were really struggling. And I thought, oh, I'm glad I have the ability now to hold space for these people, because I'm okay, because I actually went off and did this stuff for me. So they will be, as you said, able to pay it forward to others, which is great.
And not just now. The hope is very much for the long term. This is not just a short-term intervention in that way. Really trying to invest for every parent who will give for years and years to all their children, for every frontliner who will continue to tell the stories of heal the wounded of. We need them to be able to go on, and sometimes that's the starting point of obviously it's not the only point, but it's a starting point of reminding them of why they matter so much. That's easier for them to receive and accept.
If you like this episode and are looking to find out more, then please do visit Third Culture Therapy Pod on Instagram, YouTube, and Substack, and listen to the show on all the usual channels. And please do consider supporting our work by donating a cup of coffee or two to the team via our Patreon. I want to go a little bit back to your specific research and widen this to the impact on children at large who are facing conflict or who are traumatized by conflict. And you did your doctorate at Harvard University, and you led research into sort of the brain development of children who are impacted by conflict. And I wanted to ask you about your findings in that regard. What have you found is the developmental impact on children and behaviorally when they suffer trauma, when they live through war and conflict?
I do wear the two hats, as a practitioner and then also as a researcher. And as a scientist, one of the things working in psychology is that 90% of the literature in psychology is from the West. And 75% of that is approximately are taken from samples of US college students, which I think themselves would also say are not representative of our planet, especially not culturally, but for a lot of other pieces. So with that, in my research, a lot of it was just driven by questions I needed answers to. I desperately needed answers to as a practitioner, but also wanting to make sure that their voices and the realities are reflected in the literature, in academia. And so we looked at 400 refugee children, adolescents, and had a neuropsychology measure that was done on tablet. And the tablet was examining executive functioning, which are the higher levels of cognitive functioning that are really processed in this part of the brain. And we looked at both
The
trauma,
frontal lobe, right?
exactly, so prefrontal cortex, and looking at how trauma exposure, but also their experiences of chronic stress, toxic stress, and different markers of that, whether that's poverty or insecurity and so on, it would affect their cognitive functioning. So 2 things we found, I think, that are sort of the top takeaways, if you will. One is that, and this actually is supported by different parts of the literature, but in sort of more adjacent ways, was that trauma exposure was not what affected one's cognitive functioning. The two siblings can be exposed to the exact same trauma and have completely different reactions, or 2 children can, and that has to do with their individual capacities, but more often than not the resources that they have. So parenting is incredibly, and the adults who are loving them and protecting them is a huge part of their recovery. There are other factors to that too. So, but it wasn't trauma, but it was the experience of toxic stress and extended stress, whether that is in poverty and being deprived of basic resources. A lot of them are still living on plastic tarp on mud for a decade. I mean, there's just a lot to take, and then having to beg, and then not having education and so on. But then the other piece was very much that. And this we didn't actually look for. This was not a question we asked, but we found just in the cleaning up the data, was that normally when a child grows up, you expect that a 10-year-old, when I say think about a 10-year-old, I think about a 6-year-old. The 10-year-old is taller than the 6-year-old, right?
Right.
So age should predict height at some level until you are developed. Same with brain development. Age should predict the level of cognitive development. But in our data, we found that it did not. So you could be a 10-year-old with lower cognitive functioning. You could be a 6-year-old with higher cognitive functioning. And the reasoning for that, I think, is very much because of the interrupted development that has happened as a result of needing to survive continually. Because the experience of chronic stress, the average length of time that a person is now displaced is over 26 years. Wow. That's the entirety of your childhood or your youth. And so if the entire time you have to hold yourself in survival mode and you have to be hypervigilant in order to survive, you need to move fast, you need to know how to react very quickly to certain situations, and particularly to being under threat, your cognitive resources are really, in a lot of ways, burned through. Doesn't mean you're not intelligent. Those are 2 completely separate things. But it means, where is your brain prioritizing its resources to develop? Where are those neurons firing more than others? So that has all sorts of implications for refugee education. That's one. The other that we found in terms of mental health was that I studied 0 to 3-year-olds because no one studies them in this space. And we interviewed parents from Afghanistan, Iraq, Lebanon, who were Syrian, and Palestinian. There was Palestinian, yes, and then also Kurdish parents who were all fleeing from war. We interviewed them in Greece. They had come from the boats, and they were all parents of children who were aged 0 to 3. And we did qualitative interviews on their mental health and also their cognitive functioning. And parents were they knew exactly what was happening with their kids. But one thing that came out that, again, we didn't ask for, but that just came out organically, was that children under 3, 10% of them were described as self-harming.
Wow.
Self-harming.
Under 3?
Yes, under 3. Okay? So like banging their heads against something until it bled, like pulling their hair out until it bled, digging their fingernails into their faces until really they drew blood, okay? Burning themselves with what they could find. I presented this data to other psychologists, many of whom are like, no, c'est pas possible, like they're really, and I'm like, well, we cannot know what we do not know. Have any of you studied refugee children of this age? And no one has. And the reality is, I think we're in denial about a lot of it because we don't want to know that what we have let happen is creating this level of pain. But the act of self-harming, whether in adults or in children, comes from the need for an outlet of the pain, for a need, frankly, for dopamine.
Yeah.
When we cut ourselves, our bodies actually release dopamine. And so for children who are not verbal, who can't, as a 2-year-old, as a 3-year-old, you may not know exactly what's happening, but you know that it's cruel.
Yeah.
And that has to come out somewhere. So you had those, and then we also had the catatonic kids who were just lying on the floor of their caravans and asleep for days. Days and days and days and days. And limp, they were conscious. But there was the catatonia as a way of really almost the brain shutting down and saying, I need to distance myself from what's happening around me.
And through this research, how did it inform, or how has it informed practices in the field, and how has it informed what you do as a clinician?
It's informed it in many ways, but I would say maybe the top 3 that I have shared the most with my field teams is that one, healing the parent, making sure that the parent receives an opportunity for recovery is critical. Most humanitarian efforts focus on saying, like, this is how you should parent your child. The assumption that, like, brown parents don't know how to parent. And that's, as one woman said to one of these trainers that I translated for many years ago, she's like, ma'am, do you have children? Because I have 5. And not all of them, some of them were born of rape also. And she said, and have you lived in a tent on mud in a place that floods and that snows? I'd like to see you parent in these circumstances. I know exactly how I should parent, and I feel I carry so much guilt for not being able to be affectionate or to be personally present for my children all the time, because I have to go out and work and pick potatoes and do what makes ends meet. But it's not for lack of knowledge. The load of stress is so much. So that's one. The parents must be well. 2, the children must have an opportunity to repair that relationship with your parent. It's one of the scariest things in the world for any child to see their parent lose control, to lose posture, to be terrified. And unfortunately, most of the children in Gaza have seen that with their parents. Most of the war-affected children have. So, and once in northern Greece, in the camps there was a sort of maternal and child tent, and there were warplanes that were flying across that obviously triggered everyone. But the children ran to the humanitarian workers. They didn't run to their parents. And there was a moment where I was like, this is so not okay, because it's so disempowering of the parents, but also shows the brokenness of that relationship as a protecting one. So restoring that. But then lastly, my youngest patient in this context in Healing for Gaza is 2.5 years old. And during the Beirut blast, I also had a child in a similar age. Our ability to understand that they may not be able to articulate pain. In the Western culture, we put talk therapy so much above everything else. But as you may have read in the book by, Dr. Bessel van der Kolk, who is, world's expert on trauma, the body keeps the score. And so the ability to approach healing through the body is very powerful. And to also do so on their own terms. And most of the time, a lot of people will say, oh, what do we do? And I say, listen to the children, watch them. They will give you their own clues of where they can and cannot be.
The numbers of refugees are astonishing and increasing rapidly, and with very little sign of it slowing down. And we anticipate conflicts to increase, climate change related displacement also on the rise. So the need is obviously going to be increasing. And the research and the data that you've just sort of summarized for us doesn't lend itself to a very positive outlook for where we're going and how, the needs on the mental health front. What is it that you would hope you would see more of being done in the field, be it from the big organizations like the United Nations and or from an individual level? And what are the ways in which we can collectively sort of put that out there?
I'd probably say 5 things. Number 1, do our homework. Do our homework big time on the context. We often talk about things needing to be culturally sensitive, which is important, but that's not all there is. And what do you mean by culture anyway? I mean, there's so many layers and layers of subcultures as well. And so, for example, with Healing for Gaza, our entire team, our clinicians and our interpreters, need to go through a context of Gaza training. And in that, we teach about the history of Palestine, particularly of Gaza, and what implications that has for, the intergenerational pieces as well. And we also have someone from Gaza come and explain in this particular context, like what I saw in 2008 is not relevant necessarily for now, or not sufficiently relevant for what we're dealing with now. So we need to be updated, because I'm very insistent that if you're going to offer mental health, support, whether that's in therapy or whether that's in a psychosocial setting, every session must be an opportunity for healing, not for the service provider to play catch up and to say, educate me. No. So definitely do your homework. The second is to check the assumptions that we have about culture and about how also how that interacts with the needs. So a lot of people said to me, at the Oxford Trauma Conference, for instance, they're like, well, is that possible? Like, Arabs are not very into mental health. Like, there's always a taboo. And, the taboo exists in a lot of cultures, not just, in Eastern culture or Middle Eastern culture. I certainly can speak for, for Chinese culture. But the context of Gaza, in my experience that context, because there have been so many wars, every Gazan will must speak openly because that's their reality. So to check that assumption, I've had to learn to check my own assumption about saying that only Arabic-speaking clinicians are valuable in this context. Whereas so many of our patients have explicitly asked for a foreigner plus an interpreter because they want to be able to speak about things like suicide, about abortion, about extramarital affairs, things that they don't, they may feel shy about speaking in front of someone from a similar background or more religious background. The third is to work with parents, do the unsexy things. Every parent, especially in this context, may have, upwards of 4 or 5 children. So every parent you invest in, you're actually multiplying that multiplier effect. But it's often not the sexy thing to do. And so for me, in this work in Healing for Gaza, every parent who refers their child, we offer therapy for the parent themselves, even if they could not or felt too guilty to ask for it themselves, if they're ready. So the fourth is I grew up, speaking of culture, I grew up in a culture where we were taught the art of war. And one of the things that is impressed upon us from a philosophical standpoint is that how can you possibly expect to counter the impacts of such violence if you do not mobilize with the same level of discipline, of resources, of seriousness, of long-term game, of vision, all of it. And that means just even on a mental level. How to, when I, now in what's happening with both Gaza and Lebanon and having family in both contexts, I say to my friends, I pray for your mental steel, for your emotional strength, but also your psychological, balance, because those are different things, but you need all of them in order to be able to survive well. And we're surviving. We're all still in surviving mode in that way. But to know even what to ask for yourself is something the community has to learn. But if you do things in pieces and fragment the community more, you're doing more damage than good. And then the last piece of it is what one of my doctoral advisors, Professor Jack Shonkoff, who's the head of the Harvard Center on the Developing Child. He said, be bold. And for how I have taken this, someone asked me the other day when I was giving a guest lecture in Boston, how do you reconcile the fact that we have privilege? Survivor's guilt is a huge, huge piece of what is happening and in any war. And all 4 of my grandparents were refugees. 2 from the World War II and 2 from the Civil War in China. And my grandmother is the only one left, and I talked to her about this over tea once many years ago, And she said, don't waste time. Don't waste time feeling guilty about privilege, because tomorrow you may not have it. Tomorrow anything could happen to you, just like war happened to us. Refugees is not a person, it's something that happens to you as a result of needing to flee. And so while you still have that privilege, use it as much as possible as you can for someone else. And so be bold in being able to advocate for others, provide, to extend solidarity, make it less about us and navel gazing and more about what we can do in the time that we're given.
Wow, those are excellent points. You are definitely very bold, and your grandmother's advice is so spot on and really rung so true now. It kind of took me a little while to get there. And but I got there, and it was like all of this beating myself up and feeling guilty. And then I don't know what exactly, but I'm just grateful I snapped out of it. And I was like, but the whole point is that you have it to do something.
How dreadful would it be if none of us, if all of us were just having to survive?
Absolutely. But also I think someone, gosh, I can't remember who it was, but it was almost, it was like, it's actually incumbent upon you to do something, and to not only do something, but like to live with joy for those who can't right now. And that the other way is just, like you said, a little bit navel gazing and woe is me. And it actually, it's a little bit insidious in its way. It makes you think that you're it's for good, but actually it's just, as I was telling someone the other day, it's just taking you out of the game.
Yes, it is.
It's just completely made you useless. It's rendered you useless, which is, when you realize that that's what's happening, maybe then one will snap out of it and be like, oh, wait, no, I have a job to do. Actually, I have a life to live. That's the whole point of me having it. So let me not get sidetracked by, why is this happening? Well, it is. There will be a time for that. And I really loved what you said about the assumptions and turning some of those on their head, but really asking people more what it is that they want. When you told me that that many of your clients were wanting non-native speakers, right, to be able to actually speak through a translator for that reason, for the reasons that you mentioned, and I thought, wow, that's incredible. Not only that's they've articulated that that's what they need, but that even that is the case for them, but also shows how much more room there is for other people who may think, oh, we don't have something to offer because we don't speak the language or we're not from that culture. That actually, if we listen to these, you realize that you have a big role to play and there's a lot that you can do.
Absolutely.
And so, yeah, I'm glad that you've sort of found this also, found this out and are implementing it and able to help more people who need it. You might have heard of hair wraps, but have you heard of Paradise Fold 100% silk double-layered reversible hair wraps? Beautifully designed, snug and luxurious, they're the ticket to hydrated, healthy, frizz-free hair. Podcast listeners get a special discount this week with the code TCT12. I wanted actually to ask, since you brought up, your grandparents and the Chinese culture, and I really loved what you mentioned about sort of learning the art of war and understanding things contextually, but having to take a long-term vision and really deal with things structurally, not just Band-Aid. But what else have you taken from your upbringing, from your Chinese heritage, that you kind of bring into your work as a psychologist, a clinician, a mental health specialist?
I think the obvious one is that I am painfully organized, and efficiency is important. And I don't mean efficiency for the sake of it, but to say that efficacy in the way that we work, of not wasting time and resources, that we have, the limited that we have in these settings is important. So I think, I'll give you an example. The way that we coordinate as a team is that we are very much extensions of one another, and that we believe in, and it's proven its worth, and especially in times like this where some of us are really directly affected by the conflict and then others can take on that work. So we kind of minimize the personal ego in that space and say that really none of us is irreplaceable, but that, we must function as, in Arabic you say, Eid wahad, and then God's one hand. See, I managed to bring the Arabic back in there. But the second is, again, in that vision and that structure, and having to always be able to articulate the long term. What's your definition of success? If you don't have that very clearly from the get-go, you're going to get lost. It may change, ça va, that's totally fine. But having a shared vision is really important. In that, and a strategy towards it, both of those pieces. So with a lot of the efforts that I'm maybe advising or on the board of, I always say, we have to have our theory of change, and say, what's the assumption that we're making, that if we do X, that Y is going to be achieved? And you need to be able to explain very clearly why Y is important and worth the resources being put into that. I think the third is that I do think of things in terms of generations. So the importance of history in everything that we do, I think especially in this generation, most kids don't know the history of whatever, whether it's the area in London that they live, or their own family history or their own people's history. And when you lose that, you lose not only the learnings that come with that, but the strength that comes with it as well. And I think that having been with so many Palestinian refugee communities, their knowledge of every refugee, whether you're third generation at this point, fourth generation, you know where you're from, Palestine, where when can Beit al-Mukhtar, when where was the house of the mayor, the head of municipality, where the mosque was, and what your area was known for, and that gives you strength and confidence even in displacement. They speak still with a Palestinian accent, no matter where they are from their village, and they keep that, and that is strength that we give up when we don't teach our kids the language, when we don't, I told you I'm so jealous of everyone who's a native Arabic speaker, because I feel like it takes up like half my mind. I don't know.
What are you talking about? You're a native Arabic speaker. You speak better Arabic than I do.
I learned it as an adult, and it takes up all of my hard drive space, let me tell you.
That embarrasses me even more, actually, because your accent is flawless. Where did you learn?
In the refugee camps, from the kids. The kids, at first I was just convinced. I was like, there's no way I'm going to learn. It's just way too hard. It's a completely different grammatical structure and like way of thinking from Chinese or English. And the kids were like, ممنوع clichés ما بتعرفي شو اسمه. You're not allowed to eat anything unless you know how to name it. What's his name is. So I spent the first week being like, hummus. Hummus. They got a bit bored, so it went from there.
Given your affinity to so many cultures, I'm not sure which one to ask you about this, so maybe both. But from the Arab culture and from your Chinese culture, what are some of the elements, practices, beliefs, bits of knowledge that you have taken from either that help you in your own sort of mental and emotional balance and well-being?
Oh, that's a good question. I probably can answer that from multiple cultures. From the Hong Kong Chinese side of me, I think there's an understanding that there's a time and place for everything. And related to that, I'm Christian, and so my Christian upbringing, which is also, beyond, being my faith and my reason for doing this work, really, but it was also a culture. It's the idea of seasons, that we shouldn't really expect all things to be the same all the time, but that our attachment and our clinging onto it comes from a place of wanting to have too much control. And then when we let that go a bit more, there's a lot more peace in that. And I think also the understanding, I love the way that Arabs express love to one another. I mean, I come from a completely opposite culture, but we're not touchy-feely at all. We don't move our hands when I talk, whereas my Arab friends, I like hold their hands and like, talk now, try, and then they can't, and I can't, I also talk with my hands now. And so when I go back home to Hong Kong, I can get in the cab, I haven't said a word, and they know that I'm a foreigner, like that I've
Wow.
lived abroad, because my body language is different now. So the kind of love and real just expression of it, it shows a care really for, a deep care for the community that way, which I find so beautiful. And I think a genuineness there. And finding balance, just the idea that we're not supposed to be well on our own. But the first lesson in that really was when I was in South Africa as a teenager, where, you learn about Ubuntu. I am because you are. A lot of people sort of ask why I do this work and where I do it. And one quote for me by Dawood Hardy, who authored the book, The Translator, Memoirs of the Tribesman's Memoirs from Darfur. And he says, how can you be safe if your people are not safe?
Yeah.
And then he says, but who are your people? Perhaps everyone are your people. When we can see that in others will I've always felt safe in that way, that a community will always protect me where I am. And that gives a lot of balance and peace. But I think maybe finally, and since we're in London, I think if you, I will always say that I believe in the power of a cup of tea. I do. I believe in the power of tea and the kindness of strangers. I think that the more that we lean into these small ways, Mother Teresa says we can't all do great things, great things, but we can all do small things with great love. And I find a lot of solace in that, especially when we feel overwhelmed or really powerless. Because I know that those are the things that have made a difference for me. So.
I was actually just writing about this because I'm writing a piece, and one of the things I was saying is learning and appreciating much more the little acts of kindness and generosity and love, and that's what has actually set me off a bit more in sort of tears, but loving tears, and in the past few months, because I suppose I've seen how powerful it is, and maybe I've just appreciated it just so much more in the face of, I guess, so much darkness and despair, and then these like rays of light come in. You're like, oh God, it really does make a difference. But on that, obviously you are a humanitarian and working in a space that is incredibly difficult and challenging emotionally. And you're working with children. I mean, working with children is hard work at the best of times, when they're happy and smiley, let alone when they're just devastated and broken and sad. And you do this day in, day out, and you do it clearly with a lot of passion and commitment. And I want to know, how do you maintain yourself? How do you refill your cup? How do you keep the balance to carry on, and what advice do you have to others who might want to do this work, and how they can care for themselves?
Absolutely. So again, very structured, and because I do think this is the sort of discipline you must have. You want to do this work, and you want to do it for a long time. We can't be willy-nilly about it. We have to really be so intentional, at least in our effort, at least in the approach that we have. I teach with my trainees in the field, the clinicians that we have, a model which I call the self-love triangle. And the first one is self-knowledge. So it's the idea of knowing yourself very deeply, even the good, the bad, and the ugly, all the uncomfortable parts. What are the things that feed me, but also what are the things that trigger me? When are the moments where I sort of am least either compassionate, or I'm the least patient, or either with myself or with others? But also as a professional, what are the cases that I find difficult? and to be very clear about communicating that with your team and really leaning on one another that way. Because if we don't know both sides of that coin, what feeds us? For me, it's dance and music, but I also, my husband will joke that my social credits have run out. So I can only be around lots and lots of people for amount of time, and then I need to recharge. And I'm very grateful that he knows when that happens, and so then I need that time to recharge. But then also knowing, for example, I can only be in a live conflict zone for 3 months at a time, every single day, and then I need to have a break, and not to crash and burn, but just that I can really function in that period of time. But then I need a break to restore and then come back.
Just a question: do you make this a rule regardless of how you're feeling?
Yes.
Yeah, because I feel like that's important.
Yes, because then it can get wiggly.
Because people start be like, oh, but I'm still feeling fine. I'm okay. And then they just left it 3 days too long, and then they're not fine anymore. It's too late. 100%.
100%. So the self-knowledge is really important. Then the second part of the triangle is self-compassion. So really giving grace, and the same kind of grace and kindness and forgiveness that we would give to others, to not be extra hard on ourselves as well. There's no glory in that sort of suffering Olympics, and so when we can't reflect to it personally, it also loses its authenticity when we give it to others at some level. So being able to let ourselves cry, and that's again part of my discipline. If my team members come to work and I can tell they're like on the verge of it, I'm like, go home. You're no use to anyone here. You're actually probably going to harm someone because you're taking up the emotional space that they need from you. We have a list of sad movies that they cry from. They can pick whether it's Bambi or The Notebook or whatever it is. Like you can pick, but you've got to, you've got to go cry it out and then come
go
with
to the corner and cry.
Please. Yes, 100%. All the fluffy blankets, whatever it is that you need. But subhanAllah, we are made that way, and it's a gift for us to use that, to have that outlet. So we need to really use that. But the part of the self-compassion is also the discipline in making sure I'm physically well, to be moving, to be exercising, to be eating well. I am, very careful with substances, just because I know that my optimal functioning is when my body feels like clean and strong. But then with the self-compassion also is just the line of thinking that I am worth being cared for, and a lot of sort of, the wounded healer kind of model can really fall in that trap to say that I'm not worth that. And when you think that, again, it is a subtext when you talk to others about, you can't fully tell others that they're worthy as well. And then the last part is really important, especially now, and that's self-protection. And what I mean is not just boundaries with others, but also your mental diet. What are you consuming, and especially what you think that you're passively consuming, but your subconscious is absorbing. We're not supposed to consume that much brutal imagery, but also the sounds. The sound is the first thing that you become sensitive to in the womb. And so when you hear the sounds of people screaming and in anguish repeatedly over time, that's going to eat away inside you. I'm not saying that we shouldn't listen to them. I think it's important that we see them and that we witness. But especially in this work, and especially for the length of time that this has gone on in an inhumane manner, we have to be careful and mindful of that. So that's my 2 cents on that one.
Those are great tips. Yeah, and I'm really happy to hear that you practice them and very diligently, because we absolutely need you to stay in the game, please, for a very long time.
Well, I'll tell you, in the beginning of the Syria crisis, 2 of my mentors who I worshipped and I looked up to so much, who taught me so much of what I learned in the field that that Harvard didn't teach me, they burned out in horrible ways. And one of them said she was going to go to an island and write her book, for a couple of weeks, but she just never came back. Never came back, and we never heard from her.
Oh, wow.
Yeah, so as a team, we felt abandoned. And so as a 22-year-old, I was like, I can't let that happen to me if I really care about being able to serve as long as I can. And that's where all this comes out of.
Wow.
Yeah.
Those are very powerful lessons you learned early.
Yeah.
And it is significant because of what you're doing today. And I sort of want to end on this hopeful note, which is that there is this work being done. And not only by you and others, but not only is it being done, but the reception is already incredibly positive. And I actually just wanted you to repeat the story you told me the other day about the girl who has just, I think, had a few months of therapy through Healing with Gaza, and what she told you. Could you repeat that?
Sure. So this is one of my patients who she's an incredible human being, and she won't mind me telling you because she herself wants to be able to be public about this. But I think you probably remember the viral photo of the woman holding the baby in the shroud.
Yeah.
That's her. And she's incredibly brave. She's incredibly just a remarkable steel in such a young woman. And she said to me, she said, don't you do these like video testimonials of, your work and what have you? And I told her, well, it's a bit early. We don't want anyone to feel pushed or, to ask this of anyone at this stage. And she said, I want to be the first one. She said, I want to be the first one to come on video and to tell people how important this is, and for us all to extend ourselves this love and this grace, to have a space just for us to say whatever we want that is burdening our hearts. Because one of the things that I have learned through this work is that the people from Gaza, when they sit around with each other, they'll never tell each other fully how they're suffering because they don't want to add to each other's burden. So having the individual space is so critical. So it was just so wonderful for her to say, أنا بدي. She was like, أنا هكون أول واحدة. Like I will be the first person to say this, to encourage everyone else to do so, because it does take courage.
A huge amount of courage and grace and power to lose a child, a young baby at any point, but in such a horrific manner, and then to seek help and healing, and to get to a point where not only have you found some of that, but you are now wanting to loudly say to others, do the same, is probably one of the most touching things I've heard all year. And you have definitely personally affected me a lot, and I think it's a really beautiful and important and empowering story to know. So thank you for sharing that, and thank her as well for her courage. And I hope that does bring others a bit of much needed hope, and also sense of agency and empowerment as well.
100%. Yeah.
Thank you so much for sharing that, and for sharing all of your expertise and your advice and your openness and your love.
Thank you. Thank you for the generous invitation.
My pleasure. That was beautiful. Thank you for listening to this episode of Third Culture Therapy. We'd love to hear from you, so send us an email or get onto our Instagram, Third Culture Therapy Pod. Like, subscribe, share this episode with others. And please do send us a cup of coffee or two via Patreon as we push on getting ready for the next episode.